Zaitchik from Johns Hopkins University, and I want to thank the organizers for the opportunity to talk a little bit today about some work we are doing under the Baltimore Social Environmental Collaborative. So BSEC is a collaborative effort. It involves a number of researchers and students at universities in the area. That includes Johns Hopkins, Morgan State, UMBC, and some other regional universities, including Penn State, Drexel, University of Virginia, and City University of New York. It also involves our colleagues at the U.S. Forest Service Baltimore Field Station, colleagues at the Department of Energy Labs at Oak Ridge National Lab and the National Renewable Energy Lab. And very importantly, it's an equal partnership with community groups led by leaders from the Old Goucher and the Broadway East communities, but also many other neighborhoods and community members, urban farmers, organizations involved in building energy efficiency, as well as our city partners at the Department of Public Works and the Office of Sustainability. And it's a growing collaborative. And so I've listed some of the people who were there from the beginning, but we're always looking for more people to get involved in what we're trying to achieve here. And what is BSEC? Well, we're a 5-year initiative that's been funded by the Department of Energy's Office of Science. And why did they choose to fund us? Well, they chose to fund us to fulfill the following mission, which is really to work on this idea of co-generating science. And so the co-generation here is central. I think probably most of the folks who participate in an event like this one today really appreciate the fact that both for science to be high quality and for there to be value in that science for the stakeholders in Baltimore, you need a co-generation process in which stakeholders, including local governments, industry, neighborhood groups, other associations, are working together with researchers so that we can really pose the right scientific questions, fill in the blind spots that science might have, both in the kind of data that are available and kind of also the hypotheses that are being tested. And that in the other direction, we can really have a situation where science is working in directions that advance the well-being of people in Baltimore in various ways. And so we're particularly focused on this problem of climate resilience, looking at things like energy investments as we move into new climate conditions, as well as extreme weather resilience. The way that BSEC works is in this kind of iterative co-generation model. And so we work to deliberate on goals and constraints collaboratively with all of our partners, doing priority setting. We also, on the other side of this chart, see are building what we like to think of as the most meaningful environmental measurement and modeling system in the world. And I say meaningful because, yes, it's advanced. We've got some good equipment out there. We've got top-notch community leaders and scientists working together. But we're doing this all with respect to the questions that Baltimore needs answered. So it's both advanced, but also really meaningful in the way that we're designing it. That priority setting, together with the data we're able to collect and the models we're able to calibrate for the area, go into a trade-off analysis and discussion. And what that means is we say, okay, let's say that we have identified a priority area, which I'll get to in a moment. Maybe it's something like extreme heat. We say, okay, we know that that stakeholders are worried about extreme heat. We know that there's some gaps in scientific knowledge. What are we actually trying to solve for if we want to reduce extreme heat exposure in Baltimore? Because it's not just that we want it to be cooler for the sake of being cool. It's like, well, yeah, maybe you want to be cool, but probably because extreme heat has various impacts on our health, on our ability to undertake the activities we want to take, on our energy bills. These are the kinds of things that we're actually trying to solve for. And so then we can do a trade-off analysis for how we solve for those different priorities using different levers available to us. Once you iterate on that a few times, you can come up with what we're calling these potential resilience pathways, where we say, okay, working together, we haven't said, here is what Baltimore has to do. We've said, here are some options that a diverse group of stakeholders come together and said, okay, these are credible ways to address the metrics that we've set for ourselves, using the levers that are at our disposal and that we support collectively. And let's look at investments and policy decisions that push us in that direction. So the first thing we did was some goal setting, right? So BSEC started almost 3 years ago now, or 2.5 years, I guess. And so one of the first things we did was we all got together and said, okay, well, what are we most concerned about? And there are a lot of different concerns, but these 4 kind of floated to the top, which is as I just mentioned, extreme heat, which was not a surprise. That's come up as a priority in most of the city's own climate action plans and disaster preparedness projects in recent years. Air pollution, with a real emphasis on the fact that because people live indoors, right, and spend most of our time indoors, we need to be thinking about that relationship between outdoor air quality and indoor air quality, which I know is a really key focus. I think that people organizing this conference are leaders in the field of thinking about this indoor air quality issue. Flooding, again, to the surprise of nobody, that's been a major issue in neighbors of Baltimore in recent years. And then energy security, and this is a situation where Baltimore suffers from energy poverty. People really struggle to pay their bills. Baltimore is also committed to getting to net zero in coming decades, and so that's going to mean a shift in the energy sources as well as in how we prioritize energy efficiency in different ways. So how do we achieve these kind of energy evolution, the evolution of our energy system in a way that enhances people's energy security rather than exacerbating energy burdens that households struggle with? So those are some of the priority areas. The measurement and modeling system, as I said, we want this to really be meaningful. And so this is where a couple of things. First of all, I just identified some priority areas. Coming to that through the lens of science, well, that means that we have to actually address more than just those 4 areas. We need to think about all of the different fields of knowledge that might contribute to approaching those problems. So clearly, we need science that's looking at air quality, looking at atmospheric dynamics that might be related to the transport of pollutants and to heat. Focusing on that indoor issue and on the energy security issue, we really need to be thinking about buildings and energy use in buildings. So both the indoor air quality and energy usage and how those interact. We need to think about how we make decisions. That's actually a big area. I'm not going to focus on it today, but we have a lot of effort in saying, as we integrate all of this science in a trade-off analysis, how do we frame those problems in a time of kind of deep uncertainty and certainly diverse perspectives? And so on. We need information on biochemistry, on health, on the transportation system. So we have science teams working on all of this in collaboration with the various stakeholders. And on the map you're seeing here is a pattern that's familiar to any of us in Baltimore, which is the black butterfly. Here it's being plotted in terms of percent non-Hispanic Black residents as well as percent poverty in different colors. And if you were to look, what I haven't plotted here is the measurements of meteorological conditions and air quality and other environmental constituents before BSEC started. But if we did map that, what you'd see is that the kinds of monitoring networks supported by the state and by federal agencies, really incredibly useful, also sparse and not focused on intra-urban variability. So you don't have much involved, just a couple spots that get measured. If I were then to also overlay your citizen science networks, like those things that we're all getting familiar now with, people who put up weather stations in their backyards and put up purple air sensors, and then report the data to websites. Those are very much concentrated in the white L and the suburbs. The wings of the black butterfly are not well represented in those data sets, and so you end up with an underrepresentation both in the formal government measurement systems and in the informal citizen science systems. So BSEC, in addition to putting in some, really high-end sentinel sites, like, we have a couple of kind of super sites where we're trying to measure very precise and diverse aspects of air quality, of climate, of other factors. We're working through the collaborative to distribute measurements across the city. And this is actually quite a dated figure. I need to update it. But at this point, we have on the order of 40 to 50 active weather stations concentrated in the wings of the black butterfly to try to really understand things like the concentration of urban heat. We have air quality monitors that are spread around, again, trying to cover those gaps. And I can't emphasize enough how much this is important in 2 ways. Yes, we are motivated by the strong need to get information into the hands of the communities, stewarded by the communities, kind of owned intellectually by the communities to understand what's happening locally. And also as scientists, we need this, right? The partnership is a real service to science so that we can understand these complex urban environments that, quite frankly, are quite poorly represented right now. If we talk about basic understanding of atmospheric dynamics, air quality, other factors, as well as our ability to make meaningful predictions. I'm not going to get into all those measurements right now, but I just want to make a couple points. First of all, this is done collaboratively. So here we've got Last summer, we were able to get out with a bunch of events organized with community members, get some youth works interns out there collecting information, in this case on soils and other data, and participating in that scientific process. Also want to emphasize that as BSEC, we're part of a bigger picture here, right? Which is trying to make Baltimore really a global leader in understanding urban environment and climate. And so it's a balloon launch, right? Measuring some atmospheric constituents going on Morgan State last year. And Morgan State is really establishing itself as a center for this kind of urban climate environment information. And they are one of the pillar institutions within BSEC. And so we expect though BSEC has, in a certain amount of time on its project cycle, we expect to be building this kind of institutional capacity that will have Baltimore being a preeminent place for this kind of work going forward. Okay. No way that I can address everything BSEC, fortunately for you, because then I'd be talking at you for hours. So I'm just gonna give one example today, because I know that in organizing this event, there's been a very relevant emphasis on asthma, for example, as one of the conditions that we're concerned about as we improve our environment and build climate resilience in Baltimore. So I'm going to talk about heat and asthma. So first of all, here are some maps of the urban heat island that PhD student Bianca Corpus developed using some machine learning algorithms applied to our distributed measurement networks in Baltimore. Again, trying to get a better picture of what air temperature is like. And there's some average summertime conditions. On the left, you're seeing the minimum nighttime temperature. On the right, the maximum daytime temperature. Daytime temperatures are higher, as we know, but the urban heat island, this phenomenon of having the core of the city be hotter than the surrounding areas, is more significant at night. Okay, so that's why you see more contrast in that map on the left. So just keep that in mind, right? Because that's important when we start thinking about risk factors and equity here. So we're able to develop these maps. I want to emphasize that, again, these maps and others like them are being developed in collaboration with communities. And so back in June and early July 2024, folks might remember, those were some very intense heat events that hit the city. And we were able to work with the hosts of our weather stations, which are located at community centers, churches, people's back lots around Baltimore, and map out some of the temperature, in near real time, and certainly like right after the event, to paint a picture of what things were looking like. And this was allowed us to really isolate the fact that I'm not going to give you time to read all the details in these figures, but during these heat waves, we were seeing temperature contrasts on the order of 8 to 10 degrees or more sometimes at night between inner city locations and some of the leafier locations on the outskirts of the cities or in the suburbs. And so that's a substantial difference, right? And so keep in mind that we're able to do this, and we do this in a collaborative way so that communities can have those data and understand some of the distribution of risk factors, and so that city agencies and others working on planning process in Baltimore can understand where some of the disparate burdens are. So one thing that's important to think about here as we turn to how do we use these temperature maps to look at specific vulnerabilities. In this case, I'll focus on asthma, but it's not just about where it's hot, it's about where might people be vulnerable because perhaps they're experiencing energy poverty, and so don't have air conditioning in the house. Either they don't have it or they can't turn it on. Other factors that might influence things. So what this figure is trying to show is the overlap, the kind of intersection between areas of high temperature and areas of high social vulnerability. So SVI is a social vulnerability index developed by or supported by the United States Centers for Disease Control. And it weights different factors of economics and other health relevant vulnerabilities. And what this map is attempting to show is that anywhere that's blue is cooler, right? And maybe low vulnerability, as you see on the northern edge of the city. Anywhere that's brown is hot, but isn't particularly high social vulnerability. So, places like the Inner Harbor, Canton, these areas. And then you see the red areas, right? And those are areas where high heat and high vulnerability are coinciding. So these are going to be areas where we're going to be particularly focused and thinking about where there might be heat relevant vulnerabilities. And so this is, again, if we're going to turn to the Baltimore frame, the black butterfly, this isn't exactly overlapping with the black butterfly, but there's considerable, it's not one-to-one, but there's considerable overlap, particularly in the downtown portions of the black butterfly. And this is, we know, relevant to, well, we know that the vulnerability is relevant to asthma. Because if you look at something like a map of youth asthma-related ED visits, those rates are much higher in the black butterfly. And in fact, you'll see kind of highest in those inner parts of the black butterfly where there's particularly high social vulnerability. And also, as we're finding, some of the places that are the hottest, particularly at night. Okay. So there's all kind of circumstantial, right? We're saying, okay, there's a lot of overlap going on here. We also know that we're very motivated on this problem because of the high rates of asthma in Baltimore City. And so we know that this is a particular burden on these communities. And we also know that Baltimore's not alone in this, right? The American Lung Association, in their State of the Air reports, 2023 is the most recent I had access to for this, indicates that it's not just these communities in Baltimore, it's more than 1 in 3 Americans, and it is disproportionately weighted towards people of color and towards other vulnerable groups, okay? And so there is an inequity here that needs to be addressed. So with the time I have left, I'm just going to show you like one analysis we did. So first of all, with a huge shout out to Meredith McCormick, Kirsten Kohler, others associated with the Breathe Center at Johns Hopkins, who are really leading this component of BSEC for us. They're looking at asthma as a complex social phenomenon. Right? So there might be triggers. Well, we know that there are triggers related to allergies, related to, you're hypothesizing heat, but also extreme cold, other climate conditions. Air pollution might be a trigger. These all go to the person who's being affected, a susceptible host in kind of epidemiological speak. And that individual is going to be also experiencing a lot of other stressors that might contribute to an asthma exacerbation event. And so understanding this full kind of physical social continuum is really critical to understand asthma risk and to develop effective interventions. Now, in looking at this, what the folks at the Breathe Center are able to do is they're able to leverage the Johns Hopkins Precision Medicine Analytics Platform, PMAP. And so what PMAP does is it provides information in a very secure environment from electronic medical records that can then be integrated with various kinds of data, social determinants of health, or in our case, social determinants of health, and also time-varying environmental stressors. We can bring that together in that PMAP secure environment, then aggregate up to a scale that protects personal information, et cetera. And then we can start looking at things like the rates of, where does Johns Hopkins Hospital see asthma exacerbation for patients coming in? And now you'll immediately notice that, of course, this is going to be very weighted to East Baltimore or West Baltimore because of the location of Johns Hopkins Hospital. People in the West might be more likely to go to University of Maryland or somewhere else with their asthma exacerbation. But we still get a lot of information over much of the city. And we can see where both the adult and pediatric patients are coming from. We can then, in that secure platform, integrate data from satellites about the landscape, about the satellite view of air quality and temperature, with our own high-resolution temperature maps, which I showed earlier that we've developed using this collaboratively collected data, with the medical data, and also some information from the National Weather Service, which has that station in Inner Harbor and one at Thurgood Marshall Airport that measure these conditions over time. We can then integrate that and look down at census block group or census tract scale. So again, that's resolving fairly high resolution neighborhood scale variability in Baltimore. Then what happens is a whole bunch of stats analysis, and for those of us who like to geek out on this, interesting, for everyone else, interminable meetings where we talk about the statistical methods, about the data analytics, all of this stuff, in order to understand how these temperature data might inform our understanding of asthma. And so I'm going to show one figure that is too much information, then I'll try to strip it down. What Bianca Corpus, PhD student, has done in collaboration with other researchers and community members said, okay, let's look at many different ways to define heat wave. Is it a daytime heat wave? Are they high temperatures during the day? Are they high at night? How long does it last? How intense was it? All of these things, right? And so you're seeing all these bars that you're seeing on the screen are looking at different ways to define a heat wave, and looking at how much they might be increasing the probability of people showing up in the ER with an asthma exacerbation. Okay. If it's orange, it means that, oh, that particular definition for either the adults or the children using different kinds of data end up being significant. So again, I'm not going to get into the details here. What I want to do is strip it down to one summary figure, okay? Which is that if we take one, and we've done this for many of them, but if we take one definition of a heat wave and we say, okay, is the occurrence of that heat wave in summer predictive of more people showing up at the Johns Hopkins ER with asthma exacerbation? Is there a significant relationship? And what we see is that for nighttime heat waves, so heat waves defined by the fact that the nighttime temperatures are elevated, there is. And for daytime temperatures, there isn't. And this is true both for adults and for children. So nighttime heat is what matters here. And again, remember that that's the nighttime heat, this figure on the left here, that's where you see the biggest contrast. That's where there's the biggest disparity between neighborhoods and the heat exposure. And so just putting that together, we can say, okay, nighttime extreme heat events are associated with more asthma admissions in both children and adults. Okay, so that's we're demonstrating that. These are our results, I should say, are preliminary. We're submitting the article for peer review probably next month, but we feel pretty strongly about this. We also know the urban heat island is greatest at night, so the disparities are greatest at night. And we also know that there's significant interaction between social vulnerability and extreme heat in determining asthma risk. When Bianca runs these analyses and includes an interaction term that says, well, okay, does your social vulnerability at census tract or census block group scale interact with the high temperatures? Yes, they do. And so not only are heat waves associated with more asthma admissions, but they are associated with disproportionately more asthma admissions from neighborhoods experiencing various forms of exclusion and social vulnerability. Okay. Last point I'll make, just to close this up, because or to make my last point, which will take a couple slides, and bring it back to some of the themes of this meeting. Most people are inside at night, right? And so this asthma, this exposure is happening in their homes, right? It's not, and so it's hot outside. That's predictive of people showing up, but they're showing up almost certainly because of exacerbating exposures inside their homes. And that's going to be related to the indoor air quality and to the heat, because a lot of these neighborhoods don't have, again, the ability to really use air conditioning the way that one might want to during an extreme heat event. And so I'm just going to close here with some kind of advanced work that I'm not going to, that would be the subject of another talk, but our BSEC members from Penn State and the National Renewable Energy Lab are both working on this really actively to understand how row homes really work. What are the thermal conditions in row homes that are different kinds of climate conditions, especially as things get hotter and hotter and hotter? And how might different kinds of retrofits and building improvements influence this heat exposure, which, as we've just shown, could be really relevant to a problem like asthma, among many other things. And so they have a very whole sophisticated model set up that we're calibrating, working closely with BG&E to get the data we need to calibrate these models. I really value that collaboration. And just to show you a couple things of the kinds of information one can draw from these models. And so on the left-hand side, we're looking at the thermal performance as climates get warmer. And so as you go from the left to the right on any of these plots, you are seeing what's happening as climate gets warmer and warmer. And in each pair of two bars, the one on the left is if you have the home as it is, the one on the right is if you do certain kinds of retrofits. And the darker the red, the more dangerous the indoor temperatures in the absence of improved air conditioning. So what you're seeing is that as you move from left to right with each of these panels, you're getting more red, right? Not surprising. Things are getting hotter, so you're going to have more dangerous, potentially fatal indoor heat conditions in the absence of better air conditioning. If you do retrofits, and so that's the kind of a lighter color, so the right part of the pair of each of these, in general, things get better, but not always. And it really depends on what kind of row home. And so what they're showing here is like, well, what if you're in the end of group on the west side of the block? And what if you're at the first floor versus the second floor? What if you're in an interior unit, right? What if you're on an end of unit group on the east end? Like, this level of detail really matters when you think about how do we prioritize people's health and safety, because some homes, because of their orientation, where they are in block group within row homes, have different kinds of energy needs and different kinds of heat exposures. And the part on the right-hand side here is just showing the energy use intensity under those same future weather scenarios. And again, the lighter kind of colors here are what happens when you do these energy efficiency retrofits. for heating and cooling. And so the darker bars are taller, right? Because before you do the retrofit, you use more energy. The lighter bars are smaller, and it can help on both heating and cooling. What you're noting here is that the left panel of the blue and orange figure is for an end unit, and then on the right is an interior unit. Any of us who have lived in row homes know if you're inside interior of the block, you get a little benefit on your energy usage, right? Because you got neighbors on the left and right that are kind of contributing. If you're end of group, you use more energy. And so that's something to think about as we prioritize retrofits. So I just wanted to close out. So this problem of asthma, right? Then from my perspective, thinking about BSEC, well, we identify these priorities with our partners. And what we're realizing is that a hazard like asthma, extreme heat plays in, indoor and outdoor air pollution clearly plays in, and energy security also plays in because about your ability to cool your home and how a retrofit might benefit you in multiple ways. I've not talked about how urban flooding plays into that, though, as we can all expect. Anything that leads to mold in the basement will also be a factor here. We have not yet analyzed that. But just pointing out the complexities, but also the synergies in terms of interventions, right? As we think about the hazards of priority, when we get to a metric that people really care about, something like, are they or are their children experiencing more asthma? All right, again, thank you for your time today. Really appreciate the opportunity to participate.
Amazing presentation, Ben. Thank you so much. I've got a couple of questions. Do you have a few minutes?
Absolutely.
Okay, great. So first and foremost, how do people plug into BSEC? Is I guess the link on the page is where people can plug in?
The link on the page is a great way to get started, and that'll have some contact information right there. Yeah, and I apologize, I didn't put my own contact on here, but maybe if that could be shared through the meeting, or it's just, well, you have to be able to spell my last name, so that's the challenge.
I'll,
We'll find a way to get people hopefully connected if they want to be connected. Yeah.
Absolutely. I'll make sure that they
Great.
have that information.
Thank you.
And I'm in the indoor air quality space, and so I appreciate your intentionality on focusing on the indoor and outdoor air pollution, of which 70% of outdoor air we actually breathe indoors because we do spend, as you said, so much time, 90% of our lifetimes indoors. So also, shouts out to the Breeze Center, Meredith McCormick, Kristen Kohler. I've studied a lot of their research. They're doing amazing work there. And you showed a quick slide of the lung health dashboard that they created. I strongly encourage anyone that has not seen the lung health dashboard that was created by the Breeze Center to definitely Google that. Matter of fact, I'll probably put a link in the chat so people can check that out. It's a really intense study about indoor air quality, respiratory issues, asthma-related effects to that, and then the recent study that Bianca has done in regards to nighttime heat as an asthma risk factor. Wow, I'd never heard about that, and I'm glad that you brought that to our attention. What would you say is when we're talking about, you mentioned retrofits, and how that might not always be the solution to some asthma triggers when it comes to heat. Is this because they're not focused on getting enough, you know, indoor air quality, fresh filtered indoor air to address the thermal health? What do you think is the biggest challenge there when a property is retrofitted, but they're still finding that it's an asthma trigger?
Yeah, so I think so. I would say that we've not yet, what I was showing were effects of dangerous heat, not yet. We haven't made the link to asthma. I think when we make the link to asthma, exactly the point that you just made is going to be very big. And I will say we are trying to set up and looking for more collaborations to set up a good super site where we can actually do retrofits on a property while we measure it with great detail, the indoor air quality, so they can really start seeing those effects. Because I think what you just said about air exchange and filtering is going to be critical, right? We all heard a bit about that during COVID when people were talking about, like, well, what should I do with, getting air circulation in these different spaces?
Mhm.
For us, since we were just looking at the thermal exposure, it's really just that, like, if you don't have, um, you know, if you aren't running air conditioning a lot, or if you don't have the right kinds of climate control interior to your home, if you are an end of group, especially facing into the sun, right? Then some of the retrofits you're doing to increase your energy efficiency might actually bite you a bit when it comes to the place heating up.
Hmm. Hmm. So, great, great, great answer on that one. So, what would you say is maybe the number one surprise or lesson learned that you found from some of the research that you've done over the past couple of years in relation to some of your studies here in Baltimore?
Yeah, so they're coming all the time. You know, to think maybe specifically in this area, right? Since we're talking about heat and air quality and asthma. Um, I think that one surprise for me, well, that maybe I'll just emphasize that temperature result right now because we did hypothesize that that might have an influence. Um, some of those folks, over at the Breathe Center and other, we had some pretty good biostats folks at Johns Hopkins, and I'm not one of them. And so when we first started looking into this, they were saying, okay, let's really try to dig into this with some trepidation because like this is going to be a hard thing to really demonstrate. And I'm not gonna say it wasn't hard because people worked really hard on the data, but the stat, I mean, we didn't have to massage it, right? Like it just came right there on the first round. And it's like, okay, um, this is something, right? Like we thought it might be, but it's actually a pretty clear signal. And so I think to my mind, that qualifies as a surprise because you don't always see such clear signals on the first go.
Yeah, yeah. Thermal comfort definitely has been, known to, high humidity, low humidity, temperature would pretty much fall us into the thermal health, thermal comfort realm. But I never connected that to just being hotter at night, and that being one potential additional trigger.
Yeah, maybe I'll just add on that because another surprise, right? The code red system is great at what it does, right? And it's
Mhm,
looking at certain things, but it's not looking at that. And
mhm,
so
mhm,
we
mhm.
can plug in the code red heat alert threshold, and we get no significant result. And so
Mm.
it's not, we might need to think about other ways to classify heat risk.
Well, there lies the opportunity for innovative developers to create smart homes that really focus on the number one determinant of health, which is the home, and maybe there's some on-demand feature that automatically realizes that the thermal comfort, the thermal health is fading, and we need to either add some humidity or dehumidify the space or cool it down a little bit, a couple of degrees, so that Johnny can sleep a little bit better at night. So, um, to be seen in the near future. But hey, I really appreciate your time. Anything that you didn't get a chance to talk about that you want to mention before we
Uh,
end the call?
no, thanks so much. I appreciate all the time people have gotten to watch this. And again, I apologize for not getting my own personal contact on this last slide. I usually do, but please, we should find a way to get in touch if anyone watching this is interested.
Absolutely. By the time this airs, your contact information will magically appear on the slide, so don't worry about it. We'll take care
Great.
of
Thank you.
it.
Thank you.
All right, Ben. Thanks so much. Have a great weekend.
Thanks, Aaron. You too.
All right. Bye-bye.